Hello, on this video we're going to look at how to deal and control with serious bleeding. Obviously if a person has a bleed, it has to be stopped immediately, and your priority is always to control the bleeding, but we need to sort of understand and have a basic concept of the steps that we take in getting to the point where we have actually controlled the bleeding. So the first thing we do, as always, we check for dangers. Is the situation safe? If there's a significant amount of blood, you want to think about wearing gloves for your own protection and the protection of the casualty, of course, but always put danger first and then consider the situation as a result of what your findings are. On the assumption that it's safe to deal with the bleeding, we want to then get the casualty in an appropriate position, which will either be sitting or lying down, depending on the injury. If you do put the person in a seated position, I would probably recommend that they are sitting on a floor rather than in a chair, because there's still the possible danger that they may feel lightheaded and faint or tumble from the chair. So sit the patient in the appropriate position. Next thing we want to do is to have a look at the wound. And we do this for a couple of reasons. First of all, we want to see the size and the type of bleeding it is. Is it arterial? In other words, is it spurting, or is it venous bleeding where it's a steady flow? Is there anything in the wound? Has someone been impaled on a piece of glass or a piece of metal in the wound? We need to know that, because that will then dictate the way we actually treat that particular injury. Next thing we need to do is to get some pressure on the wound. So if it's an open wound, we can put direct pressure onto the wound. If there is an embedded object, we could possibly squeeze at the size of the wound. And finally, we want to apply a dressing to the wound. So to sort of bring that into sort of context, we have a little acronym of SEPD, which stands for sit or lay the casualty down, examine the wound for embedded objects or the type of wound it is, put some pressure on the wound. So for instance, in an arm wound, you may get the casualty to be able to put some pressure on that themselves while you search for a dressing. And then when we have a dressing, we will use the appropriate dressing. Remember what I've said, the priority is to stop the bleeding. So if you haven't got a nice sterile bandage and a nice first aid kit, and you've only got the tea towel in the kitchen, we do need to use the tea towel in the kitchen, because that is the priority, to stop the bleeding. The risk of infection is always a secondary consideration for stopping the bleeding first. I hope that's been useful for you. Thanks for watching, and I'll see you again soon.